What sets your company apart, and what do you do differently that gives you confidence in winning?
So NourishedRx is an integrator. Our platform connects the key stakeholders in food as medicine to really deliver a comprehensive B2B2C plug-and-play solution for payers. So we're blending technology, food, and people to really foster lasting behavior change and drive objectively measured clinical impact. And so by leading with food and employing human-centered participatory design, we're building trust and driving engagement in ways that traditional healthcare cannot. And so we should win today because all boats rise when we work together in value-based care. NourishedRx is making this possible by coordinating and amplifying otherwise siloed food as medicine solutions and also supporting community-based organizations and food systems. And so together we are transforming lives across the United States, from Somali mothers in Minnesota to veterans in Michigan. And by integrating nutrition into healthcare at scale, we are flipping the $4 trillion traditional sick care model on its head.
What case study can you cite that proves that your food of medicine works better than just medicine?
Sure. Well, to start, unlike medicine, our intervention has no side effects, drives lifelong change, and advances health equity, all at a fraction of the cost. And so it's actually hard to pick one case study because across the 12 healthcare payers we've worked with and the 10,000 members we've worked with, there have been a lot of great stories. But one case study in particular comes to mind from a diabetes program we ran with a Midwestern payvider. An independent research team found that after just 4 months, participants saw an impressive average A1C reduction of 1.3. But even more encouraging, a year after the intervention ended, they found that the reduction had not only held, but had further improved, reaching an average total reduction of 2.3. So clearly this was an example of lasting behavior change. And one of the members, Martha, who actually also serves as one of our consumer advisors, shared how that program really opened her eyes to how unknowingly processed foods had just really contributed to her family's poor health over time. And the quote I love is, "No more insulin for me, and the world feels a little more fair."
Give me something basically a family or an occurrence, something you guys are super proud of that you can share.
So I talked about our diabetes program, and I talked about Martha. I'll give you another one. There was an individual, a gentleman named Mike, lived in Indianapolis, and he had diabetes, kidney disease, heart failure, and he was depressed. And we worked with him. It was a progressive journey where we started with healthy meals for him to recognize how much better he could feel eating healthy food. He then graduated to groceries, and ultimately, through all the digital resources and education that we have and registered dietitian consults, he just became a advocate for healthy eating. And he talked about the fact that his mother and grandmother used to tell him that a spoonful of sugar was the trick to practically everything. And he started substituting blueberries in his vinaigrette and was teaching people all about it. And actually last year when I was presenting at Health, I was actually pitching to Health, could we get Mike up on stage with me? Because he had originally worked in Las Vegas as a blackjack dealer, and he was no longer housebound and depressed. He had actually gotten an RV and he was driving cross country and would be willing to stop in Las Vegas to join me on stage.